Hello, class. This is Dr. Maxfield DiCarlo. I am recording a little lecture for you. Sorry that I couldn't be with you this evening and this afternoon, but unfortunately, that didn't happen. So anyway, I'm tuning in to you from my kitchen where we are going to review the course content for this week. I'm going to review the syllabus. So I'm going to share my screen with you, and we will walk through, and you can watch this video during class time, and you'll be able, whoops, wrong thing, hold on, let's get this up here, and you'll be able to see everything you need to for class. Okay, so welcome. I know this says paradigms, and really this is advanced clinical techniques. There's been a name change, sorry about that. So if you are supposed to be in SWCL700, you're in the right place. I'm Dr. Maxfield DiCarlo, and when we meet actually on campus, you will be in room 4E22. So hopefully all of you got the message that we were doing this over the computer today. All right. So my goal for today is to do a little bit of an introduction, do a little introduction for you all as well, and I'll tell you about how we're going to do that. We're going to review the course requirements, take a look at Blackboard just to make sure everybody's familiar. Hopefully you are, but I know that there's a little bit of an inconsistency on how many people actually use Blackboard in their classes and not. So just going to make sure everybody's familiar. And then we're going to begin to discuss theory just a little bit, okay? And that's our goal for today. So, welcome. Let me tell you a little bit about me. My name is Dr. Maxfield DiCarlo. I've been teaching for the University of Maryland for about almost 11 years at this point. I teach the Death, Dying, and Bereavement course. That was kind of the baby course that I started at the University of Maryland. But I also teach the Paradigms courses or the Advanced Technical Techniques course. I am a full-time professor and the chair of a master's in counseling program, but I do that online, so I love teaching on ground. So I still teach for Maryland just so that I can come in and see students and have them actually in the course room. So I love this course. And why do I love this course? Because I was in your seat many years ago, I'm not going to tell you how long ago, didn't really walk away from my master's program feeling like I knew anything about doing counseling. Felt like I knew a lot about being a social worker and resource brokerage and doing psychosocial assessments, and then really felt like I stopped short and didn't know, like, okay, if you told me, hey, you should do some cognitive behavioral therapy with this person to treat their depression, I would have looked at you and gone, huh? I have no idea what you're talking about. So, and it took many years for me to sort of really get to the place that I felt confident in multiple modalities of intervention. And so my goal is to present you over the semester with lots of different theoretical perspectives. And here's what you'll find is that as you are looking at these theoretical perspectives, some of them might feel like, wow, I don't really like that theory very much. I don't necessarily agree with it. And so that might not be one that you use in practice. And then there might be others that you're like, wow, that just feels really genuine for me. And I think I would want to use this in practice. And here's the great thing, is that I know a lot of you are coming to this course thinking, you know what, I'm doing case management in my field placement. I'm not really doing therapy. I'm not doing counseling. That's just really not part of my role as a social worker at this point. And that's okay, because here's the great part about social work, is that the more therapeutically minded we can be as we are doing whatever our role is in our field placements in our agencies, the better we'll be able to serve our clients. So you may not be the therapist who is providing cognitive behavioral therapy, but in your interaction with clients as you're assessing what their needs are and brokering out resources for them, you may hear irrational thoughts that you can keep in mind and help correct as you're doing what your role is. So my goal is to present you with a bunch of different theoretical perspectives, help you figure out which ones sort of feel right for you, and then help you to sort of just get a firm basis in that. And then once you graduate and you continue on in your role in social work, you may find that you want to learn more about that or get a certification in trauma-focused CBT or in DBT or in existential approach or in accelerated response therapy or resolution therapy. So in your CEUs, you'll continue to do a lot of learning even after you graduate. So I'm hoping that this will sort of just wet your whistle, if you will, for some of these theoretical approaches and give you a firm foundation. So I like to teach, giving lots and lots of examples from my own private practice. My experience as a social worker has been, I started out in shock trauma and did a lot of crisis intervention stuff, then went into oncology and in bone marrow transplant, then found myself in working in end-of-life care and hospice, and then in private practice, and then also doing some research with the Evelyn Jordan Center, which is an HIV dual diagnosis, substance abuse, and mental health for folks who are HIV positive. So as the assistant director over there, and then sort of left that to just do more private practice stuff where I see a lot of folks with anxiety and depression and bipolar, and grief therapy, and then became a full-time professor. So my thought on all of this is that the best professors are the ones that are actually in the field still doing clinical work. So my goal is to provide you lots of examples that really bring some of this to life, so it's not just mundane reading about it and thinking, yeah, I'm never going to do that. Okay? So that's a little bit about me. I'll tell you a little more about me. I live in Havre de Grace, and I tell you this only because I live kind of far away. So I'm sure some of you live even further. So I would encourage you, and hopefully you got the message through email last evening that we weren't having class, but I will always post a message and send it out as an email by about 6 a.m. if for some reason we are not having class. I know that the weather is sort of crazy this time of year. Till we hit spring, there's a chance of snow and things like that. If we are not getting together, then I will post a message on Blackboard. My goal is to have class, but if for some reason we are not going to be able to do that, I will either post a lecture like this on Blackboard for you, or I will post a link where we can have a live lecture and you all can log in on your computer. I like to use Zoom because it seems to be the most stable, and we will all get together just over the computer. That being said, if for some reason you're going to be out and we're actually meeting on campus and you're going to be out because of some reason, if you would like to tune in through Zoom, I can always put in a Zoom conference call to pipe you into the classroom as well. So I like to use technology to make sure that we are all getting together and you're getting the material that you need. Okay. All right, so I also want to, I'll get back to that in a minute. So now it says it's your turn. Usually we go around the room and let people say kind of who they are and where their field placement is. What I'm going to do, because part of your grade is participation, is I'm going to put a discussion thread on Blackboard, and that discussion thread will have an opportunity for you to introduce yourself to the class. So in that discussion thread, and there'll be directions right on it, you just click on discussions, and when you do that, you're going to click on that and create a new thread. and tell us who you are, tell us your name, what your specialization is, where your field placement is, where you went to undergrad, and also when you'll be graduating, and also write a little bit about, and again, this is not like, doesn't need to be APA correct and or an essay, just a couple sentences here. Tell us what theoretical model you prefer. So here's the interesting piece of this is many of you, when I say, what theoretical model do you prefer, probably have that deer in headlights, like, I have no idea what you're talking about. That's fine. And if you don't know, then you can say, I don't know. If you took that little quiz that I put on Blackboard before class started, and you got a theoretical model from that says what your preference is, then let us know that. If you didn't do that, then that's fine too. And there's something that maybe in your undergrad field placement they use, like CBT or person-centered or something like that, then go ahead and write that. Just want to know what you think right now is your preferred model, and then we'll look back at that at the end of the semester. Maybe think through that some more to see if it's changed at all or if it's consistent with what you think now. Okay, so make sure you do that. It's not really got a due date other than I'd like you to post your introduction before our class next Monday. Okay, carrying on, I think. Hold on, let me see if I can. All right, so let's talk a little bit about the purpose of this course. We're just kind of going through the syllabus. We're going to go through that in just a moment, but I'll tell you the purpose of this course. The purpose of this course is really for you to be able to learn how to conceptualize what's going on behaviorally with clients from different theoretical perspectives and models, okay? So our goal is for you to learn these theoretical models well enough that you'd be able to hear a case synopsis and be like, okay, so here's the behaviors that I'm seeing, and here's how a psychodynamic therapist would say, that behavior is coming from these defense mechanisms or an early attachment issue or irrational thought patterns and whatever it may be that's consistent with that theoretical model. So we want you to be able to critically think and be able to identify the theoretical model, and then also clinical interventions that we might use that are consistent with that model. So oftentimes students will say to me, well, you know, I'm more psychodynamic. I really think psychodynamically. Excellent. And then they'll say, but I think that what's causing this person's distress is irrational thought patterns. Okay. Well, so in psychodynamic theory, we don't really talk about irrational thought patterns. What we talk about are defense mechanisms and what part of the personality is sort of out of whack, and does the ego need to be strengthened so that it can mediate between the id and the superego? That's really what we work on. If you're talking about irrational thought patterns, well, then now we're talking about cognitive behavioral therapy or cognitive therapy. So, so we would want to sort of develop interventions that are consistent with that model. So what I really want you to be able to do is say, here's these theoretical approaches, here's the client, and now I'm going to pick which one I think is going to be the best for this client, and then stay consistent within that theoretical model to develop treatment plans and interventions. So that's our goal of this course. Are you going to walk out of this course being an expert in all the theoretical paradigms that we're talking about? Absolutely not. But hopefully you will find a few that you think are particularly useful and functional for you as a social worker. And maybe you decide that you want to get specially trained in that. I'm sure right now you're thinking, no, really? I just want to graduate with my master's and start working. Yeah, I get that. Absolutely. But when you graduate, you're going to have to do continuing education credits. And this is really where you can like hone in on some of these, get certified in some of these interventions, if that's kind of with what you'd like to do. Now, so some of you I know are sort of in the macro specialization, and you're thinking, never in my life do I ever want to do counseling or therapy. That's not what I want to do. Okay. And I absolutely get that. So for you, again, this is really about you sort of having in your wheelhouse the understanding of behavior, so that even as you are doing your more macro stuff, you can be therapeutically minded and understand what's going on with clients and that kind of thing. So rest assured, there's something for everyone in this course. Okay, so let's talk just a little bit about the textbook for the course. Is this Walsh book, Theories for Direct Social Work Practice. It's a 3rd edition. You can get the 2nd edition. Really not a lot of change in the between the 2 editions. Here's what I'm going to tell you about this book. Is it my absolute favorite book? Not really. But I think it gives you a foundation on some of these theoretical perspectives, and it certainly ties in social work in a nice way. That being said, my PowerPoint slides and my lectures are going to give you everything that you need. So the book will reinforce what I'm teaching you. So it's a great idea for you to have read that before you come to class, so that then my lectures will reinforce that, go much deeper than the textbook, and you will have that information for reference. Now, if you're someone who loves to do database searches, I know some of you are like, no, I really don't like going to the library at all. But if you do, and you would like to type in the theoretical perspective that we're reviewing for that week and get some articles that will review that, I absolutely think that's a fantastic idea. Okay, so the school would like you to have this book. You do with it what you wish. I'm going to give you everything you need. Okay, so you'll have everything you need to address each one of these theoretical perspectives. Okay, so we're going to look in just a moment at the syllabus directly. I'll put it up on the screen so you can have a look at it. But just so that you know, this course is made up of 4 things. One is attendance and participation. When we are online like this and you're watching a lecture, I will post a discussion thread, and that discussion thread is not requiring you to write an essay and use references and be all formal. No, this is mimicking a conversation that we're having in lecture. So if we are actually on ground. So like I said, this week I'm going to post a little thread for you to do a little welcome message, and that will count as your participation. In the event that we have any other classes that are online, I will post a discussion and you'll get your participation and attendance points that way. Again, it's the point of those discussions is to make sure that you've watched the lecture and that you are getting what you need, and then I'll give you your participation points for that. There's a midterm in this course, and here's what I will say about the midterm. I don't design it. As some of you are probably aware from the syllabus, if you've looked at it, this is an assessments course. So the university uses this course to put in a couple assessments that we use to assess every student coming through the School of Social Work to determine if we are, if you're learning what you need to learn according to the competencies that are required by for accreditation. So the midterm I do not design. The ethics assignment I also do not design. But I will adequately prepare you for both of those. The midterm will be an in-class. I've already reserved the computer lab for the day of the midterm. And basically it gives you a case, and you're gonna have to analyze that case using two different theoretical perspectives, okay? By the time we get there, you will be thoroughly prepared to analyze that case from multiple different perspectives, okay? So that's an in-class midterm, the date's on the syllabus, where you'll get a case and you will have to analyze that case from two different perspectives. There's also a reflection assignment on ethics. Now, I know most of you have probably been inundated with ethics at this point in your program in undergrad and now. So I will post the information for that assignment. It's not due until the end of the semester, but if you'd like to get a jump start on that, you absolutely can. There's not much more that I'm going to teach you about ethics that you couldn't probably complete that assignment right now and do just fine on it. What that is that you're going to pick an ethical situation that you have encountered in your field placement, or if you've worked in mental health in a job, and you're going to describe that ethical situation and then discuss the ethical decision-making model that you used to sort of break down how you would, how you did resolve that issue, or if you weren't the person that was in charge of resolving that issue, how you would have using an ethical decision-making model of your choice. So that also is an assessment assignment. So everybody in the school completes that exact same assignment. The final paper in this course is the only thing that's unique to my course, and it's a theory-based case study. So what's going to happen is that I'm going to give you a case of Mr. Jones, and I'll post that on Blackboard in the next week or so. And what you're going to do is you're going to analyze that case using 4 different theoretical models. So you're going to analyze the case using 4 different theoretical models, giving me a summary of the model, how it would apply to Mr. Jones, and then any interventions that you would use using that model with Mr. Jones. And then once you do that, you're going to choose the model that you think fits best for Mr. Jones. And you're going to write a section of your paper on justifying using that particular theoretical model, and so why you would want to use that model. And that's really where you're going to dig into the research. You're going to need to have at least 5 research articles that are reflective of why you would choose this model to work with this particular client. So you're going to need to give him a diagnosis, and then look into the literature and say, oh, look at this. I think I should use solution-focused because there's evidence that solution-focused works with this particular diagnosis. Or I think I should use cognitive behavioral. Or maybe I'm going to use psychodynamic. And you're going to go through just justifying the model that you're picking. And then you're going to write a very brief, this is not a treatment planning class, very brief treatment plan. And basically what I'm looking for in that, and now we'll be talking more about what the treatment goals are for each of the different theoretical perspectives, but is for you to show me that you are staying consistent within your theoretical model choice, and can develop a treatment plan that stays consistent with that theoretical model. Okay, so more information to come about all of those, but for now, just be thinking about that you're going to be doing a lot of analysis in this course using the different theoretical perspectives. All right, so I'm going to switch gears here for a moment and just make sure if anyone is not able to log into Blackboard, that would be super unfortunate because you're probably sitting in the class wondering where I am. But hopefully you got the message in the email, and hopefully you have a login for Blackboard. And so I am hopeful that you all have that. If you don't, please contact the school and make sure you have that immediately. All the papers that are in this course are going to be submitted through Dropbox. That's really important because we are doing the assessments for the university through on those 2 assignments, so it's important that they are in Dropbox, okay? I will post, I've already posted the course materials, so you will see that all of the PowerPoints that we'll be using for the entire course have already been loaded into the course room. And you'll see most of them are for 2 weeks. So you'll see it'll say week 1 and week 2, and then it'll say psychoanalytic, which is what we're going to talk about next. And you'll see all the different PowerPoints that we'll be using so that you can print those off and take notes as we go along. The syllabus is also on Blackboard so that you have a copy of that. I made copies and killed a small forest for you, and then I'm not here today, so, but I'll bring those with me to class next week. Also, I use the announcements. All of these videos that I create will have the announcements, will be posted in the announcements so that you can go back to them and watch them whenever you want to. And also, if there's inclement weather or there's something going on, we'll always post an announcement there. So make sure that every time you log into the classroom on D2L that you take a look at the announcements to make sure that you're not missing something, okay? All right. And your final exam is that theoretical, theory-based analysis paper. Okay. So let's just, I'm going to get out of here for a second, and I'm going to pull up this syllabus so that you can see it really quickly, because I want to make sure that everyone is clear on all of the requirements. So here we go. Okay, so I'm teaching 2 sections of this semester, so I'll be putting just 1 video in, so 2 to 5 and 6 to 9, just so that you know. Okay, so here's my email. Should you need to get a hold of me, feel free to do that. You can do it through Blackboard as well, so that is available to you. This phone number right here is my cell phone because I don't have an office on campus. Okay, so if you need to get a hold of me, your best bet is to call me on that cell phone number or to text me. I would say that texting is probably the best bet because I am in meetings quite often and won't be able to answer the phone, but I would be able to text you. So just the caveat to this is that if you're working on your final and it's 1 in the morning and you think, I would really like to ask Dr. Maxwell DiCarlo a question, let me just call and leave a message on her answering machine. My phone is going to go off right next to my bed at 1 in the morning. So please don't do that. Try to make it during normal business hours. Certainly there's some flexibility in that, but I would say after about 7 or 8 o'clock at night would not be most appropriate. Therefore, you can feel free to text me and I will get back to you just as soon as possible. I try to return emails within 48 hours. Every once in a while that gets a little iffy, but if you haven't heard back from me within 48 hours, please feel free to call me, text me, or shoot me an additional email and say, did you get that? Just to make sure that we can communicate and you get what you need, okay? All right, so we are gonna be reviewing many different theoretical models this semester. Psychodynamic, we're going to be looking at cognitive behavioral, solution-focused, narrative, which is one of my favorites, motivational interviewing. If we have time, we might talk a little bit about accelerated resolution therapy, which is a big therapy, much like EMDR, that is sort of making its way onto the scene for PTSD and trauma. So we might talk a little bit about that as well. And also throw in a little bit of DBT stuff, and also acceptance and commitment-based therapy, which really have their tenets in some distress tolerance, which is probably one of the most important pieces and practical pieces in therapy today. So lots of things we're going to be going over. The next stuff here is all about prerequisites and the knowledge and skills and values that you're going to get out of this class. feel free to read through all of that. Good stuff. Okay, so required readings, we've already talked about that. There's supplemental readings here as well. Again, one of the books that I would highly suggest, if you're interested in getting some books that you think are things that you would want to have on your library shelf forever and ever, I highly suggest Corey's Principles and Practice of Counseling and Psychotherapy. It's a fantastic book by Gerald Corey, that's with a G. Great book. We're actually going to be watching videos from that book throughout the semester. He has a video series where we watch one client, Stan, and Dr. Corey intervene using each of the different theoretical models and interventions from each to work with Stan. So we're going to be watching those starting in 2 weeks for each theoretical model, so that you can see these things in action. And so there's a book that he has that goes along with that that is wonderful. So we'll be touching base on some of that. Okay, so we already talked about the assignments. There's that midterm, the ethics assignment, also attendance and participation, and theory-based case study. You'll notice, I just noticed that the point system is slightly different on here. So we'll be going with what the syllabus says. Okay, so here's more information about all of that. We've already gone over that. The thing I want to bring your attention to, certainly if there's anyone who has ADA accommodations, please don't hesitate to reach out to me. Timely submission of assignments. I, in general, will take 5% per day after if an assignment is turned in late. Certainly if there's an emergency or something that is going on, if you let me know ahead of time, we can work together to get you through. Here's the part that I want to let you take a moment just to read through whenever. Like I said, this course has assessment assignments that are used. Everyone in the entire school uses them so that we can evaluate CSWE core competencies for accreditation. So you'll see the ethics assignment in the midterm, touchdown on certain competencies, and that's all right there so that you can have it. Okay? Okay, so lots of blah, blah, blah. Feel free to read through all of that. Here's our course schedule. All of the reserves should be available at the library, and they should be under the course title. Not positive. Sometimes they forget to put it under my name. So if it's not there under my name, then go ahead and look under the course title, because we don't get the e-reserves up and ready for you. The course coordinator, because it's an assessment course, does that for us. So if there are any problems with that, let me know and I can contact the library or the course coordinator. Okay, so there you have all of the readings. We're going to spend this first 2 weeks talking really about theory. What is it? Why do we care about theory? And then also assessment. How do we do a good psychosocial, spiritual assessment on a client? What information is important for us to ascertain from our clients so that we can understand what's going on with them, and then be able to think through what's going on with them from a theoretical perspective. So that is our goal for the next 2 weeks. And then starting February 11th and 18th, we're going to start talking about psychodynamic approaches. If some of you hear Freud and think, oh man, I am hopeful that this will broaden your perspective so that you have a newfound appreciation, if nothing else, for psychodynamic approaches and psychoanalytic. So we'll be talking about that for those 2 weeks. And then we're going to move into talking about cognitive behavioral therapy, And so that will bring us up to the midterm, because for the midterm, we'll be using both psychodynamic and cognitive behavioral to analyze the case for the midterm. Okay, so one thing I do want to let you know is that, and this is probably more disclosure than you ever needed, but the reason that I wasn't able to come to class today was because I was diagnosed with pneumonia a week and a half ago. And unfortunately, because I'm short of breath, my one lung is not working properly, and I need to have thoracic surgery. Now, I'm hoping that this resolves on its own, but if not, February 11th, I am scheduled to have surgery. So what that means for you is that I will most likely, in the event that this doesn't resolve on its own, I will be out of class for 3 weeks. And before I leave, I will post lectures like this for those 3 weeks. And then I will return, hooray, by March 4th, and we will have class as normal. So I just want to let you know that I promise you, you will get all the information that you need, and that these lectures will be posted for you so that you can learn this material, and we'll create an avenue. There's a sort of a virtual office on Blackboard where you'll be able to ask questions in the event that anything doesn't make sense. But if for you that does not work, I absolutely understand. Won't take it personally if you need to switch to a different class that will meet on ground and not have this little hiccup in the road. So again, there's a chance that that won't happen, and that would be fabulous for me and fabulous for you. But in the event that that does, again, these don't work for you and you don't like this format, then please let me know or talk with the registrar, and we'll see what we can do to accommodate you. That being said, I will be there next week, and we will kind of go from there and see what's happening. Okay. All right. So then we'll have our midterm, and then we will from there start talking about more integrated approaches, mindfulness, solution-focused, and narrative therapy. And by April 22nd, we will have completed all of the theoretical models that we're going to talk about in the class. And then finish up the class talking about some evidence-based practice, ethical stuff, and cultural applications and multicultural applications of these theories. All right, so there's the syllabus. Hopefully that is helpful. And I'm going to move back over to our PowerPoint and talk just a little bit more, because my goal for today, usually we spend a lot of time sort of doing introductions and things like that. I'll put it on that discussion board. My goal for today was just to talk a little bit about theory. So thinking about theory is, why is it important? And what is theory? So theory is really, if you just think about it, is when we are looking at a phenomena and trying to sort of make sense of it so that we can predict, in this case, behavior and symptoms. Okay, so so theory really becomes for us sort of a way to structure and understand a phenomena in a way that is very based on the scientific method and very systematic, so that we can understand why things happen the way they do. Okay, so that's a really sort of loose definition, but that's really, sometimes we get very worked up about theory and think it's all like, I have to conceptualize it this way. And really all theory is trying to do is help us sort of put parameters around a phenomena so that we can understand, and in some ways even predict, when a certain behavior, in our case, because we're mental health, will occur, right? And when it won't occur. So we're trying to sort of make sense of things that we need, that we want to understand, okay? In the notes, there's a Webster's Dictionary definition that you can look at. Again, all of these PowerPoints are right on Blackboard for you with notes and references and all of those things. Okay, so why do we care about theory? Why do we care about putting all of that into sort of a framework so that we can understand it? Well, okay, imagine this. Imagine that we didn't care about theory, and every time you saw a new client, you would have to look at all of those symptoms and be like, no idea. Let me try to put that together, right? That would not be very efficient and helpful to our clients, right? But because of theory, we are able to conceptualize what's going on with them and be able to come up with categories of what their symptoms are, be able to give them a diagnosis, and then based on theory, be able to say, I think we can treat this grouping of symptoms with this particular model because we have systematically looked at understanding the underlying etiology of the problem and that these interventions impact that, right? So we've sort of created this all-encompassing theoretical model to help us intervene, right? So when we think about it this way, right? Much of this is based on research, and that's what theory is there's systematic research to understand a phenomena, right, and make sense of it. So imagine that you were diagnosed with a life-altering illness. So maybe some kind of cancer, you're diagnosed, and you go to the oncologist and you walk in, and the oncologist is 90 years old and is still practicing just kind of as a professor emeritus in the medical school. And they say, back in the day when I was in medical school, we treated cancer with leeches. So once a week, I want you to come in. We're going to put leeches on you to suck your blood, and hopefully that'll cure your cancer. Now, would anybody stay here with this physician? Probably not, right? You'd say, I think we've come a long way. Based on theory and scientific research, we know that that's not what we're going to do, right? Maybe there's surgery, maybe there's chemotherapy, but you better believe you want the most cutting edge, most up-to-date, right, intervention possible. And that's what theory is really doing, is it's creating this framework for us to understand a phenomenon so then we can do research to figure out how to intervene in the most effective way to help people, recover and either cure or increase their resilience or what have you. So theory kind of provides that framework for us. And it's interesting to me, so oftentimes when I talk with clinicians and social workers, they say, oh, well, I got my master's. So yeah, I know what to do, right? But then there's no continuing, we all have to do continuing ed, but there's no continuing looking at research. Like, I know no one really likes to go to the library and do database searches. And I shouldn't say no one, because maybe some of you really love doing that. I love doing database searches, but we should, in mental health, continuously be looking for new theoretical perspectives, new treatment interventions. Look at just trauma, for example, right? Is that we used to think that it was just all about exposure therapy and that was really the staple of trauma treatment. And now we know that exposure therapy could be not an actual exposure, but just a cognitive process. So we have cognitive processing therapy. We have EMDR. We have accelerated resolution therapy. We have all of these different theoretical perspectives that have all been based in theory that have now developed to create more effective interventions that now can treat pretty resistant PTSD and trauma-related stuff. So, that's really what we want to be doing. Okay, I'll get off my high horse about that. This is really why we should be allowing theory to guide our clinical practice. So some of you might go into your field placements and you might say, what theoretical perspective do we use in this agency? And the social worker might look at you with a deer in headlight look like, I don't know, right? So here's the thing, is that we want to not only focus in on what we know works for whatever reason, right? It works. But we also want to be rooted in theory. We want to be rooted in, I'm doing this intervention because it is consistent with this theoretical perspective, which tells me that this problem is rooted in this particular concept. And if we intervene on that, then we will be able to make change, right? So part of theory is being able to come up with predictability, be able to predict how our interventions will impact the client and their symptoms to resolve their issues, okay? So that needs to be the clinical practice. We don't want to just have clinicians who say, oh, well, I don't know why I did that, but it seemed to work, right? That's not acceptable. That's not what we want. We want to know why we're doing what we're doing. Hopefully part of this class will be very validating for you, because sometimes we do things naturally, and maybe we don't have an understanding of why we do that, and we find that it works. And we look at these theoretical perspectives, and then you say, oh, you know what? What I was really doing was an ego reinforcing technique, and I didn't even know I was doing it, right? It'll give you the framework for understanding what we're doing in clinical practice. Okay, so when we're talking about theory, there are 3 different types of theories that your book reviews. And so it's just important to keep these in mind. So the first one is case theories. Case theories really just, these are those fun articles to read where you have someone who is providing treatment to one client and, excuse me, and they just report, like, here was the client's symptoms, here's what I did for an intervention, and wow, look, it worked, or wow, it didn't work, okay? It's one case. And so in those particular situations, we're applying a theoretical perspective to one case and just seeing if it worked, right? Can we take the information from that one case and generally apply it to everyone in that situation? No, right? We wouldn't want to do that without adequate research. So case theory is a one-person case. Isn't this interesting that this worked this way? It's the foundation. Maybe even we could go to say it's the starting of grounded theory for understanding, like, this worked with this one person. Maybe we should try it again and do a broader research study to apply it to a certain population or a sample of the population. But it's only one case in one situation. Mid-range theories, on the other hand, explain behavior of a set of cases, people that have something unique in common. Okay, so these theories might look at a segment of the population, say 9/11 victims, right? And it might say, hey, we're gonna apply this theoretical approach and do this intervention with firefighters that were in 9/11, okay? And so does it explain all trauma for non-firefighters or first responders or military folks? No, it just takes a small sample and it says, here's what we did with these folks, and it seemed to work with these folks, right? So a little bit broader than case theory is mid-range theory that helps us explain a set of cases or an event, okay? What we're going to be talking about in this class are what we would deem grand theories. These theories try to explain all behavior, okay? So it's not just a set of people who have experienced a similar or common thread. Rather, it's all behavior. So interestingly, when we look at things like psychodynamic approach, it really is very comprehensive, whether you agree or disagree with that theoretical model. It's very comprehensive, and it honestly will help us understand all behavior, not just trauma, not just grief, not just anxiety. It is across the board, helps us understand behavior. And cognitive behavioral therapy is the exact same way. All of the theories that we're going to be looking at throughout this course will help us understand behavior in general in their grand theories. Okay, so we're not going to do the group exercise, but before we move on, let's just talk a little bit about why do we need so many theories? Well, because if psychoanalytic was enough to cure or get people in remission from their symptoms, why do we need more than one theoretical perspective? Well, because not every perspective works for every person. Here's an interesting idea. There's been research that shows that if a client comes in and believes that they're going to get some sort of psychodynamic perspective, right, in their model, so they're going to lay on the couch and they're just going to like free associate. If they believe that that's what they're going to get and that that's what will help, interestingly enough, that's what helps. If a client comes in and believes that someone is going to take a much more directive approach, be much more collaborative, more like cognitive behavioral therapy, then there's a good chance that that's going to work better. So is that to say that the other approaches wouldn't work? No, but it is to say that that we need to choose our theoretical perspective based on, one, our competency, two, what works for the client and what their expectation is for therapy, right? And three, the research that shows what's the best interventions for that particular issue that the client's coming in with. Okay. So here's the other piece, and we're going to be talking about person-centered therapy throughout this course, Rogerian perspective, and their Rogerian or person-centered therapy has the basic principles of that, right, have basically been integrated into all the other theoretical models at this point. So that seems like not very much like rocket science to us. It seems that having empathy is kind of essential, right? And not being non-judgmental in the therapeutic process, and establishing a therapeutic relationship is pretty essential, right? We have lived in an era when that sort of just makes sense for therapy. But that is not necessarily the case for when we look historically at what social workers and counselors, their goal was. It has not always been that it was thought that a therapeutic relationship was probably one of the most important pieces of the process. For example, if you look at psychoanalytic, the therapist stays very flat. They have a blank screen for which clients can project onto them their issues with early attachments. So because of that, the therapist does not try to create an empathetic relationship with the client. They attempt to keep a therapeutic distance so that that projection of attachments can actually happen. And so because of that, when Rogers came on the scene and said, no, I think you have to establish a good therapeutic relationship where you're showing empathy and care and concern and a non-judgmental attitude, that sort of rocked the therapy world, right? Psychotherapy changed forever at that point. So I say all of this just to say that not only do we have to look at therapeutic interventions and theories and models of how we intervene with clients, but there's something to be said for the fact that even if you don't carry out an intervention perfectly, that we can, in some sense, some belief, from different theoretical models, that we can rest on the therapeutic relationship and simply coming in and having a therapeutic interaction where one person has sort of this incongruence and the therapist has congruence will create this dynamic where a environment for the client that will naturally then be able to create change, right? Whether you agree with that or not, there's this idea that if we create the safe environment, that change will happen, okay? So if we believe that, I wish I could move this out of the way. Oh, there we go. If we believe that, then it's very important for us to understand what the important characteristics of a counselor or social worker are that could be impacting this therapeutic relationship, and in essence, creating change regardless of the therapeutic interventions that we're using. So the characteristics of a good counselor, this is taken from one of our other textbooks. I just want to kind of review these, and we're going to stop after this, and next week we will talk about assessment. But one of the most important characteristics is that we have our own personal identity, right? Clients are going to come into therapy, and the first thing they're going to look at is they're assessing you, okay, to see if you're genuine, if you are you portray that, and this is like interpersonal stuff, right? That you portray that you know what you're doing, right? That you know who you are, right? That's really important. So that's one of the reasons why, if you look at all of our competencies that we're looking for in social work, is that we want self-reflection. We want to be growing as a therapist and as a social worker, and figuring out what our own identity is in the process, because we could get a lot of knowledge and skills, but if we don't sort of work on our own self-assessment, then we may be missing a piece that is very important to the therapeutic process. It's really important that we respect ourselves and respect our clients, right? I mean, this is like straight out of the code of ethics, yeah? Is that we have to respect our clients and the diversity that they may bring in to the therapeutic process. But in that, we also have to respect ourselves, right? Which means that we need to, and I know I'm bouncing around a little on this, is that we need to set some really good, healthy boundaries, that last one, and maintain boundaries. This gets challenging sometimes for social work. You know, we all come into social work because we want to help people, and we want to help people function at the best level that they possibly can, and be the best version of themselves. And so sometimes our boundaries can get a little bit sketchy because we want to help people. But we as social workers need to make sure that we are never in a situation where we're working harder than our clients. Again, we don't want to work harder than our clients. We want to guide them, excuse me, so that they can make change on their own. Okay. We need to also be willing to make change, right? I think essential to social work is this idea that people can change. And in that means that we as social workers also have the possibility that we can change. I think back to when I first started in clinical practice and the interventions that I used with the limited knowledge that I had, and how I treated clients then, and now looking at the interventions because I have a lot more knowledge that I can use. So just want, there's a lot more techniques that I can pull from to be more effective with clients. So we change over the course of our careers as well, and we may change theoretical perspectives and what works. For example, when I was in school, there was this weird intervention called EMDR, right? Something that we all kind of said, oh, that is weird. No, this is some sort of weird fluke thing. But as the years passed, we started to do more and more research on why EMDR works, and it had amazing results. And then we sort of had to grapple with that and say, okay, I'm willing to kind of look at this because it's showing fantastic results. And now we know it's actually standard practice for trauma and lots of other things. So we need to be willing to change, and we need to believe that our clients can change, right? That seems very simple. But there are times, and you may have experienced this in field, that clients come in and our supervisors and coworkers will say, oh, well, they're just a drug addict, right? Hopefully you never hear that. But things like that, oh, well, I know how that goes. The chances of them not relapsing are very small. When we start thinking that way or hearing our colleagues think that, we need to start readjusting and making sure that our professional value system is consistent with social work's value system, because that is not how we approach clients ever, right? We, many times in therapy, it's like a little microcosm where we're creating this environment for people to have a safe place for which then they can try out new skills. And then once they try them there, can take them out into their world and try out those skills in their real world. So in their own unique world. And we are oftentimes modeling behavior that is healthy, hopefully, right? And really helping the client and modeling behavior that shows that we're vested in living life to the fullest, and we want our clients to be able to do the same. We need to be sincere and authentic and honest. Clients can see straight through any time that you are in a situation and you're not really believing what you're doing. That should be a flag for you. Maybe this isn't the theoretical model that works for me and is genuine for me, because if you don't believe it's going to work, the client's not going to buy in. Okay, so we have to be very careful with that. A sense of humor, so important in clinical practice. Sometimes we take ourselves so seriously, and we need to kind of step back from that and realize that we're human, our clients are human, and that we can laugh. We can model being able to laugh at ourselves, being able to laugh at our mistakes at times. Really important that we do that. I remember when I first was working in oncology, we were doing rounds, and the physician said, we did an MRI of her brain and they found nothing. And I just busted out laughing and said, if they didn't find anything in her skull when they did an MRI of her brain, then most certainly cancer is the least of our problems, right? But we say things and we take ourselves so seriously that we don't even hear what we're saying. So we have to step back from that sometimes and just allow ourselves to laugh. Along with that is recognizing and acknowledging our mistakes. I can't tell you how many times I've made mistakes in therapy and had to go back to it and say, hey, you know what, last week I was really focused on this, but you brought an issue in and maybe I didn't attend to it as much as we should have. And I'm sorry, I'd like to go back to that if that's important to you. And clients will see that and see that genuineness, and that you are able to acknowledge when you have made a mistake or your concern that you have, and then they're modeling that behavior, so then they're going to be more willing to not be defensive and recognize their mistakes. Okay? Now, if you look at this list and you think, oh my goodness, like I can't be a social worker, don't do that. This is an idealistic list that are things that we as social workers and individuals need to just be working towards. Does everybody come to the table with perfect mental health and those are the only ones who can provide treatment? Of course not. That's not the way it works. Okay, so we want to learn to live in the present. Again, how many of you, you're graduate students right now, I would make a guess, and this could be an assumption, that it is at times hard to live in the present. And if that's the case for you, that doesn't mean you're not a good social worker. It just simply means that that's something that you have to work on, because we all have those moments and things we have to work on, right? The other one here, cultural influences. We talked a little bit about that, but we need to appreciate culture. And here's the thing I'd say that's most important. Is we need to be willing to put culture on the table for the client to talk about. There are so many times when I'm not an expert on every culture, but I might have to say to the client, hey, I don't know what the experience is of living in Baltimore City as an Hispanic male. But I want to know, can you tell me what your experience is and how that's impacting how you're feeling? And be willing to say that instead of just ignore that there could be some very different experiences than I have ever had. So important that we just put that on the table. And never have I had a client said, well, you know what, you can't possibly understand me. No, I'm not going to tell you, right? Is that when we take the position of, I'm going to learn from you, you tell me, because I don't know. Clients are in general very willing to acknowledge the differences between myself and them, and then be able to talk about those so that I can understand their experience. Sometimes it's all about gentle inquiry and being humble in counseling and in social work of, I don't know what your experience is, but I surely would like to know, right? And I think that also goes to communication. If you're not a good communicator, then maybe you need to work on some interpersonal communication skills. That's important, because in social work, that is what we rest on, is on our communication. We need to be vested in the welfare of others, which, again, I know I'm talking to a group of social workers who probably got into social work because they're vested in the welfare of others. We need to be able to find purpose and meaning in our work, right? This is hard work. There are lots of situations in which we, as social workers, are faced with hearing very challenging stories and trauma. And we work sometimes, you know, when we're not keeping our boundaries, we work harder than our clients. And sometimes they're just not at a place to accept some of the help that we are offering. But we're using ourselves to try to help make change. And that's the unique thing. It's not like we are working in a field where we don't use ourselves, or we just do a skill and that's it. We're using ourselves and our being and our personality and our characteristics, all of those things. We're using ourselves to help make change. And that can be exhausting. So we have to set good limits, and also really sort of dig deep to find the purpose and meaning in our work and why we're doing it, and keep focused on that. Okay, so I'm going to stop there for today. I hope that this is helpful and that you enjoy watching this lecture. Don't forget to do your little welcome discussion thread, and I will see you all next week. We'll talk more about assessment. If you have any questions, concerns, feel free to give me a call. Again, my number is there, or post something in that little general questions thread that's on Blackboard. All right, take care, and I will see you next week.